In my experience, anything minimal or less invasive will succeed over time. History shows this very clearly, and carotid stenting will go exactly the same way. First point. And second point, the way is towards more secure for the patient, mesh-covered stents. I'm in a position where I can do open surgery as well as stenting. And from my perspective, the near future will show a shift towards stenting because of mesh-covered stents and a drastic decline of open procedures with equivalent results. I've started using mesh-covered stents more than 2 years ago. Our stroke rate in highly symptomatic patients is absolutely great, which means we had no neurological events in these cases, where normally I would expect a certain stroke rate. And we have used these mesh-covered stents in very challenging anatomy like kinked internal carotid arteries with excellent results. The CGuard, in comparison to other stents, even in comparison to mesh-covered stents, is a very easy to use device. You don't need very sophisticated measurements to do beforehand, and it can be used in a wide variety of pathological diseases with excellent results. When I use other stent grafts, mesh-covered stent grafts, I need very complicated measurements before in order to make sure that foreshortening or lengthening of the stent is no issue. With CGuard, that's very simple. You take it off the shelf and you use it, and that's it. Big advantage for me, but also for the scrub nurse and everybody else involved. The small port does make a difference. First of all, it's got excellent flexibility. Second, it's a little bit like a flow modulating stent, which I want. I want to have a more laminate flow compared to a more turbulent flow, which is very good. And I can use it in very kinked, curved internal carotid arteries, where I can't use, for instance, a closed cell design stent from other manufacturers. It has changed my daily practice, and we are doing carotids on a daily basis. Insofar that I'm now performing carotid stenting in patients where in the past I was sure these are better candidates for open surgery. But then again, open surgery does have a lot of drawbacks as well. The cranial nerve injury, for instance, even when you do this kind of procedure in local anesthesia, the patient still has to recover from it for a couple of days. A patient I stent today can be discharged tomorrow. A patient I do an operation on today has to stay in hospital and ICU all in all for 3 to 4 days. I can treat more patients in a shorter period of time. The normal patients, so to speak, can be treated with stents in 30 minutes very easily. I do recommend treatment of highly stenotic asymptomatic patients with this kind of stent as part of my armamentarium. I can do this knowing that the risk of this kind of treatment is far below 1%, which I don't get when I do open surgery, even in elderly patients. When we combine the best of two worlds, flow reversal plus a mesh-covered stent, we can get excellent results, and in my opinion, probably even better than open surgery, and that's still the gold standard. CGuard will shift the indication of an endovascular procedure towards the more asymptomatic, high-degree stenotic patients, and it's right so. We can argue about this for hours, but that's my personal view. And I think the future will show that's exactly what's going to happen. In my opinion, interventionalists who want to do carotid stenting should use CGuard because it's really one of the best mesh-covered stents available. I wouldn't do carotid stenting without a good mesh-covered stent like CGuard.